Hello, everyone. A very warm welcome to another webinar from SciSpace. Today, we are going to explore the topic of coping with burnout and compassion fatigue. In this brief but impactful session, we'll delve into the intersections of these two challenges, exploring how they affect individuals in various roles, from healthcare professionals to caregivers and beyond. Joining us today are esteemed experts who possess knowledge and experience in the realm of mental health. Allow me to introduce our prominent speakers for the evening. Firstly, we have Ms. Lija Chaudhary, a psychologist currently working as a school psychologist with Project Child. She has done her master's in clinical psychology from Cotton University. She has also worked at PsychSpace and has major contributions. Secondly, we have Ms. Yeja Chaudhary, who has been a mental health enthusiast since a very young age and is known for her being vocal about her journey with body image issues as a storyteller in her Spotify original podcast, Dear Teenage Me, and various social media platforms. Miss Yeja has her master's in clinical psychology from Christ University and is currently working as a psychologist at PsychSpace. Then we have Ms. Dipshika Kalita, who has done her specialization in clinical psychology under Assam Downtown University and is currently working as a psychologist at PsychSpace. Uh, Lastly, let me introduce myself. I am Alankrita Saikia and I have completed my master's in applied psychology from Nehru Group of Institutions, and I am also working as a psychologist at PsychSpace. We welcome
Thank you
you
so much,
all
Alamgita,
to
for the introduction.
I heartily welcome you all and thank you for dedicating your valuable time with us. I'm certain that our viewers are eagerly looking forward for to your enlightening discussion.
Thank you, Alamgita.
So, without further ado, let's delve into our topic. So, we already have an idea about burnout and fatigue. But what are basically, how do we define burnout and how do we define compassion fatigue? Fatigue as a whole is a different term, but compassion fatigue and burnout is a different term. So, how do we define that and what are the key differences between the two?
Alamgita, I would like to go forward with a question. So, is it all right? Yeah. So, when we talk about burnout, like I think like in today's world, because of the internet, because of the social media, we keep on hearing the word burnout, 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 burnout. So, and as the word suggests, burn, whenever we see something to get burned, it's basically into ashes and it's reaches to its extreme state of exhaustion, right? So, whenever we talk about burnout in a similar manner, for humans also, burnout is basically a state of chronic physical and emotional exhaustion that occurs as a result of prolonged stress or prolonged stress or any stressful event which has been for a very long period of time. And basically, we use this term related to the workplace setting, the regular work that we do. And it is character. There are like few characteristics of that particular term. So, as I have said before, burnout is an emotional state, and it is caused by a very prolonged period of stress, prolonged period of being in tension, having a resistance to doing everything on a very prolonged way, in a very enlonged way. So the first characteristic or first dimension of burnout is basically the emotional exhaustion. Now, when we talk about emotional exhaustion, what basically does that mean, right? Because we heard about exhaustion in terms of physical exhaustion, like not feeling like feeling lazy, feeling unwell, and then things like that, terms like that. But when we talk about emotional burnout, that same feeling that you have for your physique, that you're not being able to get up from the bed, you do not have motivation to work, you do not have the feeling to, attend things that you like to do beforehand, but now before you used to attend and now you have a hard time dealing with it. The same thing is basically is for emotional exhaustion. So feeling drained out, feeling fatigued, feeling lethargic, having no motivation or very less motivation, and having very less interest that you used to have before. Let's just say like before you were working in a company, or you were working in a company which was your dream company. All right, you always wanted to work with that in that company with that particular position that you are basically working in right now. But due to the prolonged exposure to that company, due to the prolonged exposure to the stress and the workload by the company, you have come to a emotional state where you don't feel like working for that company, where you don't feel like working for that particular job anymore, for the particular position anymore, right? So that is basically what we call as like emotional burnout or emotional exhaustion, exactly. So the another feature that we have that like burnout has is like reduced personal accomplishment. Like I said, like whenever like we join something, we start working at somewhere, at the very beginning we always have a very good feeling about it, and you actually enjoy doing the work, you actually like doing the work, being in the workplace, meeting with the new people, meeting with the people, having a good team. You enjoy that. But when you reach to a level when you have been prolonged exposed to stress, then there is a reduced personal accomplishment, the feeling of ineffectiveness, the feeling of that you lack of achievement, and you don't want to achieve the things that you wanted to achieve before. Right. So that's what the word burnout means. Now, when we talk about compassion fatigue, now compassion fatigue is not a very clinical word that we get in a day-to-day life. There's no disorder like clinical fatigue or like, sorry, that is not disorder like compassion fatigue and stuff like that in DSM or ICT. But basically, when we talk about fatigue, when we talk about compassion fatigue, it's a very realistic, it's a very evidence-based term and condition, to be very honest, right? So, compassion. Now, what is like compassion? Compassion is basically you are motivated, you are interested, you have the same wavelength that a person is wanting to do something or something like that. And when you have too much compassion towards one particular job, towards one particular field, or towards one particular position, and then the continuous phase where phase that you have to go through that again and again and again, and where you lack your own boundaries, your own mental health, and your own physical health due to the demands of the position, due to the demands of your work, then you reach to a phase which is called as compassion fatigue. Okay, so compassion fatigue is basically a state of mental and physical exhaustion that can be result from exposure to trauma, or by caring from by taking care of others' emotional pain. Okay, when you take care uh, of people, when you take care of patients, it's basically seen in the medical health in the medical sector, to be very honest, because on a day-to-day life, life, the front line medical workers, or in the front line health workers always have to be very much compassionate towards their patient, very much compassionate towards their client. So when a person is in a field like that, then a prolonged duty, a prolonged work to work with those survivors of trauma, those victims of abuse and stuff like that, when you work for a prolonged period of time, then you start to get somewhere compassion fatigue, because the trauma that's been dumped on you for a prolonged period of time, if you don't have that boundary with yourself and with the job that you're doing, at the end, it can result into compassion fatigue. So yeah, I have I think I explained pretty much about burnout, and that's all I have to speak. That's all I have to share from my end for compassion fatigue and burnout.
Thank you, Yeja ma'am, for your insightful input. And yes, I agree that when it comes to being when it comes to a person coming from helping profession, it is very difficult because uh, from time to time we have to be compassionate to the person because it is our work, it is our job, and we have to take care of them from time to time. And sometimes at times it gets exhausting for us because it is not easy being compassionate 24 hours or through the entire work time. And it can build up a lot of stress, it can build up a lot of uh, exhaustion in us, and can end up getting can end up to compassion fatigue. So would the other speakers like to add anything?
I guess Yoja has already explained it really well about burnout, with definitely with like life examples. And yeah, compassion fatigue is something that people really don't talk about it. And I think through this webinar, at least people will be knowing that what compassion fatigue is. And as burnout, people have started to know about burnout, but I think it will be really helpful for the people to know about compassion fatigue. Yeah, from my side, I have to add this much only.
Thank you, Lisa ma'am. So now moving on to the next question. So what are the common signs and symptoms of burnout, of compassion fatigue, burnout and compassion fatigue, that we as individuals should be aware of?
Yes, Alamkrita, I would like to go ahead with this question. Thank you for this question, and Ms. Eja has already spoken about burnout and compassion fatigue and has given us like a very good idea of it. Now, going ahead with the signs and symptoms, these are the things that one might notice or feel, and this affects the signs of burnout and compassion fatigue will affect both our work life as well as our personal life. So, in terms of personal life, we will see the symptoms in our physical, emotional, and mental health. So, first of all, physically and emotionally, we'll be feeling very drained. So even after resting, okay, we get off work, then we rest. So even after resting, the feeling of exhaustion, which Isa ma'am has talked about, it doesn't go away. We will continue to feel that drain throughout. Then there are like certain complaints of experiencing headaches, stomach aches, or other physical health issues, and this will come like without any clear reason. And another sign is becoming very easily frustrated or agitated or angry over minor issues. One might also face sleep disturbances and not getting enough sleep throughout the day or oversleeping throughout the day. And then most of the time, the people who are going through burnout, they might prefer to be alone and they might avoid social interactions and they tend to isolate themselves. Before they they would enjoy going out to these social events, but after going through burnout, they would mostly like to keep to themselves and remain isolated. So, and in terms of their work life also, there are significant changes. They start developing a negative attitude or cynical attitude towards work, just like talking about work or bringing up the topic of work itself will bring a negative attitude in them. They'll start to hate talking anything related to work, and then they will start developing a distance or withdrawing mentally and emotionally from their colleagues and clients. So, what would happen is that before they would enjoy chatting with their colleagues or being in their company, and now they would sort of start distancing themselves from it. And of course, their work productivity will also be affected. Their motivation will be low, and engagement at work as well will be low. They'll struggle to focus or concentrate on any specific tasks that they're given. They'll also make many errors in their work, or they'll maybe forget if they were assigned something, they'll forget to complete it. And they'll, even after completing their work, it will be such that they'll feel dissatisfied by their work or feel unfulfilled whenever they have done something. It could be like they said before, they would feel very satisfied or very enthusiastic about their work, but after they have started facing or going through burnout, they will be very unenthusiastic about their work. So these are certain signs and symptoms, or some of the common signs and symptoms that will start become visible in their lives.
Thank you, ma'am, Deepsika ma'am, for wonderfully putting it forward. I'm sure this was knowledgeable for for our viewers. So next, I would like to ask. There's a question from one of our viewers. So Salman Khurshid Majumdar has asked, "How does someone build compassion about that thing when they feel they have already reached their burnout?"
Anushka, I think I would like to go ahead with that question. Thank you, Salman, for the question. It's very rightly said. Like, if you are passionate about a job, if you are passionate about a role, you have so much compassion towards that particular position, but then again, there is too much of workload, there's too much of, expectations from you from that particular job, and then you are not being able to be compassionate to that particular job anymore. So in that case, what do you do? Basically, that's what I think Salman is trying to ask us. So, Mrs. Dhawan, I think the first thing that we need to keep in mind is that keeping a routine for ourselves where we actually prioritize our self-care. Work, having a good work-life balance. Work is not your entire life. Work is just one of the pillar of your life. Apart from work, you will have your personal life, your social life, your family, your other aspects of life. Maybe you prioritize those things as well, apart from your work only, and maybe take and obviously, apart from the personal, apart from the social and your family life, family and things like that, I think something that you need to really take care is your own self, your personal life, taking a good amount of time for yourself, doing whatever you want, doing whatever that you feel passionate about. Maybe it can be workout, it can be, journaling, it can be going out and eating a good food or something like that. Basically doing something apart from thinking about the work, apart from thinking about that particular expectation that you have to fulfill for the organization or for the company. Another thing is that, like I said, work life balance, it can only come with boundaries. If you have a good boundary with your in your life, apart from like the things that you have been doing, and if you set good boundaries in your life, that is when you can have a very good, bounce back to that particular thing that you're going through, and you would know when to stop yourself. You would know when the expectations are too much rather than what you have signed up for. And if the company is asking for too much, then that is the period when you can step inside your when you can step in your boundary, and you can say that I'm really sorry, I would not be able to do that, or I would not be able to take forward that particular job expectation of yours. Right. So I know boundaries can be a very hard thing in the very beginning to go forward with, but it will come with a lot of practice, I would say. You know, it's not an easy thing, but firstly, you'll have to know, and we all have to know how to set boundaries and how to take care of ourselves better. And if even after having a good self-care regime, even after having boundaries, even if you're still having, problems to deal with your compassion fatigue, or if you're still having a problem to deal with your burnout, I think talking to someone one on one as a professional help would definitely work for you, work for anyone who's going through a burnout currently. And yeah, and keeping a good lifestyle, I would say, at the end, because I know everyone speaks about having an 8 hours of sleep, have less screen time and stuff like that. But if you actually follow those things, and if you actually put your lifestyle in a better way, then it would definitely be a plus point. And yeah, having a mindful practice and stuff like that. Basically, taking care of yourself apart from having a shift of perspective that work is not the only life you have, that work is just a pillar of your life, and you have other aspects of your life as well to look after. So I think, yes, this is what I have to add from my end. If anyone's like to add anything more, they can feel free to add.
I think, yeah, I think it would be repeated enough, but yes, thank you for the question, Salman. It's a really good question as well because we don't know how to tackle this because we may try to build the compassion even after we have that burnout that okay fine, I'll try this much, I'll try this time, it happens. So as Yeja said that prioritizing yourself, our own self is the biggest thing that we can do right now, and taking care of ourselves is one of the biggest thing that we should do. So rather than if you're facing multiple times of like burnout and you are not able to build compassion, then definitely you should set certain boundaries, and certain mindful breaks are definitely suggested during that time because it will help you to rejuvenate as well as it will be a kind of a positive break for yourself. So yes, from my side it's basically that.
Thank you, Yeja ma'am and Lina ma'am, for your inspiring and enlightening words. So next, I'd like to know about the most common question that comes to our mind whenever like we think about burnout or fatigue or compassion fatigue. So what are the underlying causes or which contributes to burnout and compassion fatigue?
I'll go with the question maybe. Yeah. So, when we say burnout, I'll just discuss burnout, the causes of burnout, and the causes of compassion fatigue in a different way. So, when we say burnout, causes, we have different dimensions in our life, our work life, our personal life, our social life, everything. So, when we say causes of burnout, it may come from any of the dimensions and it depends from people to people. People have workloads, definitely. If someone, when we say workload, there is a, a person A who always try to pend all the things, he or she will try to put it in the pending zone. There will be another person B who does all the work, but there are certain pressure tasks that will be given from the organization side or might be the company side. That is basically a workload. Second thing I would say that we usually have that tendency not to say no, like what is ours, or like as Yeja say that, making the boundary is very very important. First thing, knowing my job role, knowing what I should do in my job, in my given position, I should do that rather than compiling all the work of others' position is not my work. So setting those kind of boundaries are very, very important. And one also might be feeling burnt out when a person is not given that accessibility to access certain resources in the organization, or the person feels very inferior. First, if we say, like, no one gives that certain kind of support is definitely one thing, but imagine a situation, or imagine a kind of workplace where a person enters and the person even doesn't know, the person even doesn't know that whether the employees over there knows him or her, and he or she has not been given that accessibility to use certain resources, like go to certain events to gather experiences. So in that kind of situation, a person won't be able to gather that, okay, I the part of organization, will I be a contributor, will I be contributing something. And next, I would say that reward, whether definitely we get paid every month, we know, but certain rewards when we say, like verbally, or might be in a bonus or anything that an employee definitely deserves, is very, very important. Rewarding someone is very, very important. A person, an employee, puts his or her 100% time, effort, day and night to uh, complete a certain task within a given period of time. And I think with that situation, one needs to definitely reward. And uh, one can also talk about that if someone is not fair in that, or not playing fair in the like in office, or might be in a situation where a person who does 80% of the work is not being rewarded, and the person who does only 40% has been rewarded the highest. So in that kind of situation, it can also create a kind of burnout, a kind of emotional burnout where one can go through. And with that, like, we also have certain kind of personality traits like perfectionism. We want to do it in a perfect way, so that can also lead to burnout. Certain tasks, if we do it according to it, it's fine, but if we have certain kind of personality traits within us, that can also lead to burnout. And adding to that, lack of sleep or no support, definitely that is something very, very important. If we need to take care of ourselves, we need to apply certain holistic ways also. So those are one thing. Now if we talk about compassion, the causes of compassion fatigue, then definitely it's a very important thing that one needs to, like, when someone is exposed to certain kind of uh, like situation, like traumatic situation, death, anything. So definitely that is another one. And here I want to point it out that when I was might be on a leave, and Yeja was working, and she actually called me regarding uh, like death of a patient, of an old patient. And that is something that when we get certain kind of information, definitely we sometimes we feel that emotional sense right there. But when we kind of attach to a patient more, then definitely compassion fatigue will definitely occur. Second, I want to say that when someone is repeatedly exposed to someone else trauma, like for example, we can say yes, death, or any kind of destructive situation, and not able to line out the boundaries is very, very important thing. Like, we as a psychologist, or any worker working in any of the field who are dealing with traumatic situation in medical sciences or anywhere, we have to deal with patients traumatic situation, or doctors have to deal with certain kind of situation. So we have to create a boundary first thing. Like, we are someone who will facilitate the guidance, but we have to create that boundary that once the patient leaves the room, it's something that they should not leave the trauma with you. We should not be thinking day and night about that traumatic situation. Okay, the patient has gone through this, how must she be feeling? So those kind of thing needs to be going out once the patient goes out. So that is basically about uh, lining out the boundary. And when we say overtime in workplace, what happened within us, or might be in medical sciences, uh, we have to deal with patients, or we have to go through with patients for a longer period of time. There is no fixed time period where we can work, or there is a kind of postponing of sessions, right? So in that situation, what happened, sometime I might not be available, sometime my colleague is available. So if someone overtimes, or there's like uh over over like, what we can say, like we can say कि बहुत ज्यादा ड्यूटी कर लिया हो, तो that can also lead to compassion fatigue. Like, if my duty is from 9 a.m. to 6 p.m., and if I also take my colleague's duty from 6 p.m. to 10 p.m., so that is a double way where I am exposed to certain kind of traumatic situation. And if that goes on, overtime goes on more, like another multiple times, then definitely that will be a kind of alarming situation, if we say. Yeah.
Thank you, Lisa ma'am, for enlightening us. Uh, and yes, when it comes to burnout and compassion fatigue, we have to be mindful that, especially talking about burnout, it is very important to feel that belongingness from the workspace. If we give our 100% all the time, and we are not appreciated for the work we do, then definitely there will be a time when we'll feel exhausted emotionally, we'll feel like we are not doing enough, and then it comes to burnout. And also, talking about burnout, intrinsic motivation from within is also important. When we are appreciated in a workplace, when we feel belonging, we feel that belongingness from our colleagues or from our co-workers, we feel that motivated enough to work. And then burnout, even though we have this feeling of burnout, we feel motivated to work. And then when it comes to compassion fatigue, also coming from the background of helping profession, it is very important for us to take a break when required. Because if we keep on doing, like, if we keep on explaining ourselves that it is our job and we need to do it from time to time, so it is very difficult for us. As at times we might feel worked up, or we might feel stressed because of our job, because we have a lot on our plate. So it is very important to take breaks, and it is also very important, as Lisa ma'am and Yija ma'am mentioned, to create boundaries when required, to talk about, like, to take a step and think about ourselves, which comes in self-care. So next, I'd like to go to the next question. So, how can we recognize when there is a risk at burnout or compassion fatigue, and what steps can we take to address it proactively?
Yes, Alamkrita, thank you so much for this question, and I would like to go ahead with it. First of all, I think we're all familiar with the term hustle culture. It is always appreciated to keep multiple jobs or to do multiple jobs, and On the other hand, taking a break from our job or quitting a job is not as socially desirable as doing multiple jobs. So, what happens when we have been brought up like this, or uh, when this mindset has been ingrained in us? Throughout this, we fail to recognize the steps or fail to recognize the risk of burnout. We just keep on being consumed by our work so much that we forget or um, we forget to be mindful about our own self. So, how can we recognize this that we are facing a risk of burnout? First of all, this will happen, as I've been mentioning, this will happen through self assessment or noticing changes in the self. So, first of all, we can evaluate our own mood, see if lately we've been having lots of ups and downs in our mood, see the changes in our energy levels. Is our energy level really down? We can try to notice that. Then we can also evaluate whether our sorry for the pause, but we can also notice whether our work demands have exceeded our own capacity and whether we've been feeling overwhelmed and are constantly under pressure. And we can also notice certain emotional responses to work situations. For example, suppose we've received a mail from our superior, and we've also or we are in a meeting, and someone has said something to us, and if that starts a nervous reaction or nervous response, and if that keeps on happening again and again, then we can recognize that as a manifestation of our stress and burnout. That is like something that we can notice. And then we can also notice the changes in our interpersonal relationships. As I've mentioned before, our relationship with our colleagues, maybe, or maybe with our own family members and friends. So, a lot of recognizing the risk happens through noticing the changes in ourselves. And when you've also asked about how can we address that proactively, basically, Yuja ma'am and Lisa ma'am has already said a lot about self-care practices. So that is number one. We have to prioritize ourselves, and that will happen through maybe through exercises for someone, maybe through proper diet for someone, maybe through adequate sleep for someone, and maybe through other hobbies for someone. Whatever makes the self feel like that I have been taken care of. So it can be different things for many people. And then number two, most important is establishing clear boundaries. So as I've mentioned before, that there is a work life and there is a personal life, and are through burnout, both of these lives are being affected. So we have to establish clear boundaries between our work and personal life. We have to limit working overtime or avoid taking work home. Let the work be done at workplace only. And to further support this, we can also allocate like specific time for our hobbies and social activities that we enjoy. Then also we can reach out to our trusted colleagues or friends or whoever is available for emotional support and guidance. And most important is that we should not hesitate to ask for help when needed. This also means that going to a professional mental health worker whenever it is needed, or if the symptoms persist or worsen with time. And there's another point which is important, that is reflecting on our goals or values which we have set for ourselves. So before joining any kind of job or before going to any kind of workplace, we have set certain values and goals for ourselves, right? So we need to reflect, like, are those being met? Have our priorities been set straight? So we need to reassess that, and at the same time reassess our workload and commitment. Like, we need to see if the workload that we've been given and the commitment that we are giving is matching up to our values and goals that we have set for ourselves. So it is really, really important for us to see or go through all these steps that I've mentioned. And by paying attention to these early warning signs, we can really, really decrease the risk of burnout and compassion fatigue.
I guess there's a network issue. Um,
Yeah, I think Ankita is facing some
Let
network
her join.
issue.
We'll wait
I
for
think let's just wait for like 3 minutes or
Yeah,
something. Yeah. Also, like what Dipshika just said about like how to balance everything. I think another
mm,
very important aspect I feel is that learning to say when to say no. You know,
mhm,
when should we can't we can't do that. Or learning to say no to our particular expectations and stuff like that. I think that is another really important thing. Even if it can also be a self-care measure, learning to say no to people because we overcompensate ourselves in some day-to-day lives. So yeah, along with like we were just continuing the discussion, whatever like the points that Dipshika ma'am has just said. We were just elaborating that a little bit. So can you hear us, Alankita?
I guess she's having major network issues.
Alankita, you're mute. We can't hear you. Unmute
Yeah,
yourself.
unmuted. Or might be you
Can
can
you hear me
switch
now?
down the camera for, might be due to the camera, it might be,
Video thing.
yeah,
Yeah.
just,
Am I audible now?
Yeah,
yes.
yeah, you are.
Okay. Okay. So I'm very sorry for the inconvenience. My network has been broken. So as I was saying, as Shikha had mentioned, it is very important for us to like understand that whenever uh, especially with hustle culture, as again Shikha mentioned, it is very, very important to like take a break, and also to it is okay to take multiple jobs, but taking multiple jobs means having multiple responsibilities. So it is very important and it is very much required to take a break. As I was saying, it is very important for us to leave the job. Not the first step is to leave the job, but then if we are working multiple jobs and it's too much for us, it is okay to step back, and it is okay to place ourselves uh, place ourselves in in priority and prioritize our mental health, and also reflect on our goals. And also it is very important to limit working overtime. Nowadays, working overtime is always appreciated in a workplace. When a colleague or when a worker is working overtime, that means the person uh, is
I guess, yeah, she was talking about working overtime. So,
Yeah, yeah.
yeah,
Like I said, learning to say no is like a highly, highly suggestible tip because I really feel like Rishika said, due to the hustle culture we have, everyone wants to make money in a very young age. We want like if you scroll through internet, if you scroll through YouTube and Instagram, you will see that there are reels and there are contents which are basically like 18-year-olds being a millionaire, being a billionaire, stuff like that in a very young age of in a very young age and stuff like that. I mean, that is completely fine. Like he or she has actually put his blood, sweat to make those money and to become that successful and established. But on the other hand, this should not be a reason of you to feel pressurized to work in that certain way where you are, putting yourself in extra, hard conditions to like fulfill and to match the competition because the hustle culture is so much appreciated. So I think, yeah, this is something that we should definitely look up to.
yeah, yeah. Like,
Alankita, can you
we,
hear us?
I think,
Yes, I'm really sorry. My network has been really working up and I keep on getting disconnected.
That's completely fine. Yes, that's completely fine. Your audio is really good right now, so maybe you can
yeah,
keep the camera turn off and we can just speak,
Oh,
right?
okay.
might be the
So,
network is also going through burnout.
so
Yeah.
thank you for your insightful knowledge. So, coming to the next question, I'd like to ask this question to Yeja ma'am. So, are there any particular challenges that psychologists may face when dealing with burnout and compassion fatigue in their professional roles?
Yeah. Thank you so much for that question, Alankita. Um, I'm not mute, right? Yeah, yeah. So, um, I think like being a mental health professional and being in this field, you are so much exposed to other people's hard time, challenges, the hard things that they're going through, the vulnerable times that they struggle with, the trauma, the abuse. And I mean, we go through some people's deepest, darkest moments in their life, right? And we are human as well. And I'm pretty sure like we have our own sets of trauma, our own set of bad experiences from the past. So obviously we are not a supernatural human being. We are not a supernatural being. Even we are also human. So when people are our clients, our patients, when they speak about their bad experiences, about their traumatic experiences, it definitely, has an impact on our mental health as well. But the main important thing that one must remember here is like how this is only impacted to you if you are, if you are not healed from your end as well, right? You are only triggered when you also have some unprocessed memories or unprocessed experiences from the past, then you can definitely be triggered in the present. But when we talk about compassion and fatigue and burnout, a psychologist or a counselor or any mental health professional would definitely go through some personal challenges and some professional challenges. First of all, I believe that our the work hazard, I would like to call it to be our work hazard, like the emotional drainage that we have, because the amount of emotion we put throughout the day to our numerous patients, numerous clients on a regular basis, somewhere there is this significant emotional exhaustion from our end, because we go through, we listen, we, you know, analyze, we, try to understand so much of our patients, whatever they have gone through. So there can be, and there is a lot of emotional drainage that happens from our end because we try to give so much out to the people, but sometimes it is very the thing that is left with us, the emotion that is left with us is very less because we tend to give out a lot rather than receiving, right? So another thing is that empathy overload. There is a very important thing in psychology, and every budding psychologist or anyone who wants to be in the field of mental health always has been taught about empathy. What is empathy? You always have to listen from another's point of view, and you have to, step into another's shoe and another's point of view to understand what they're going through and stuff like that. So on a regular basis. Now imagine empathy to go through on a regular basis, on a prolonged period of time, on a persistent period of time, right? So how much empathy is too much empathy? How much empathy do you are giving out on a regular basis? That is very, very important to understand because if there is a very overload of empathy, you are deep when you are deeply empathizing with your clients, that can also take a toll on your own emotional well-being, your own mental health. Because, when you give out more than you have, it is basically calling for an SOS. Because at the end of the day, you will also suffer somewhere in a long, if not today, but in the long run, you will suffer. So another personal challenge with psychologists, I mean, I think we all would agree with that, is we also, even though we preach boundaries and having a healthy boundaries and stuff like that, we often even have poor boundaries in our regular life, because our work is a profession, is a sort of profession. I'm so sorry, there's a power cut out. I'll just turn off the camera for a minute, maybe before the internet drops out. Yeah. Uh, am I audible?
Yes, yes, Yoja.
All right, all right, all right. So as I was speaking, that even though we preach and even though we teach a lot of people about uh, boundaries and how to manage your boundaries, but there are a lot of young psychologists, there are a lot of, mental health professionals that they themselves go through a very hard time maintaining a clear-cut boundaries because a profession sometimes demands immediate, response to a client, to a patient. Let's just say a patient is going through a very suicidal ideations and suicidal thoughts and stuff like that, and he or she is on a verge of, committing suicide, or is on a verge of, having a panic attack and stuff like that. We always demand they always our patient always demands so much of attention and so much of care on a regular basis that we even sometimes have poor professional boundaries. Another thing that even we all go through on a day-to-day life is poor work-life balance. We do challenge with that. Even though we know having a good work-life balance is very important, but sometimes even we overcompensate our work and we even overcompensate our task. Another set of challenges that we face, like mental health professionals can face, is like when you have heightened self expectations. Sometimes we also have to understand not if every patient, every client is something that you deal with. Sometimes some patients, some clients needs to be referred. When you cannot take care of a patient, when you cannot take care of a client, you have to sometimes refer it to someone else, right? So when you have a heightened self expectations, this is particularly see in type A personality people, they really want to have, perfectionism in them. They really want to challenge everything that comes to their way. But high self expectation and a sense of responsibility towards the client can make it hard to acknowledge and address the personal burnout. When you address so much about the patient, sometimes and most of the times actually, it can be really hard for you to acknowledge and address your own personal burnouts. Right. Another thing is like these were a few points, which is like personal challenges that a psychologist can face or a mental health professional can face. Coming to the professional challenges, I really believe that if you, for a prolonged period of time, sorry, so if you, for a prolonged period of time, if there is an empathy overload to the patient, sooner in the coming years, there will be a decrease in empathy because you would be desensitized in future. Because like just like doctors, like doctors and surgeon, because they see blood on the regular basis, they see so much of blood and other things that which is not okay for people to see, and where a normal people if they see it, they can have a heightened reaction to it. But even the doctors had a heightened reaction to blood and stuff like that. But over the period of time, because they have deal with these things on a regular basis, there has come a point where they have desensitized it, right? They are not sensitive anymore to it. So even in our profession, we know empathy is one of the most important aspect and important component. But when you overcompensate your empathy, when you overdo your empathy on a longer period of time, there is going to be a desensitization, or there is going to be a decrease in the empathy, which is eventually going to which is eventually going to have a poor professional life and professional, like the best, like let's just say you can give 100% to your client, now you're giving 80% or 70% to your client because the decrease of empathy and stuff like that. So your whole therapeutic efficiency would be less than before. Another thing is that when you go through burnout on a regular for a prolonged period of time, your judgment, your decision making, your other cognitive aspects can also take a toll on you. You would have impaired judgment, you would have impaired decision making process, and that will eventually have consequences in your professional life as well, because you wouldn't be able to take therapy, you wouldn't be able to give the best that you can give to that client or to that patient. So these were a few challenges that mental health professionals can go through on their regular basis or on their in their professional life. Now let's just talk about what are the strategies, how do we manage burnout and compassion fatigue. Like whatever we have been seeing all this time, and whatever advice or whatever ideas or suggestions we be giving to our viewers, we are not no different. I think we also need to practice that. We also need to adopt those habits, be it self-care, be it taking regular breaks, having a healthy lifestyle. These are things that not just our patient needs to do it, but even we need to do it on a regular basis. We also need to take regular breaks. Now, taking breaks can be even for an hour or even for weeks or months. That is depending on your level of exhaustion. That is depending on your level of rejuvenation. The moment you feel rejuvenated, the moment you feel you are fresh again, you can bounce back to your professional life. That's completely fine. But the main purpose of the break should be that you are off work, you are not doing your work, you're not thinking your work, but you are giving prioritizing your break at that moment, and you're not thinking about work even when you're in the break, right? That is something. Another thing that we I think a lot of psychologists, a lot of mental health professionals, they do is like taking professional help. Every psychologist, every mental health professional has their own mental health professional with whom they go, and they go and they talk about it. They whatever they're going through on the regular basis, because metaphorically speaking, you can only when there is a turbulence in a flight, when there is a turbulence, in a very smooth journey, and all of a sudden there's a turbulence, you need to put your own mask rather than helping the next passenger that's sitting next to you, right? You need to help yourself first, because the more safe you are, you can save more lives with that, right? So in the same manner, I think all mental health professional, if there is someone who is not aware of it, mental health professional do need other mental health professional to take care of their mental health. That is very important. We all need to go to therapy. We all need to take care of our mental health. And yeah, professionally taking care of it is the best thing. And another thing is that, like I said before, having a clear work-life balance. Work is just one pillar of your life, one aspect of your life. It's not your whole life. We need to know how to regulate the other pillars of our life as well. And yeah, having a good work-life balance, I think that is something that we all should be working towards. And when I talk about having a work-life balance, I mean that not bringing work to home. I mean that learning to say no, learning to not overcompensate yourself, work as much as you are, as much as you signed up for. Like when you took a job, there were expectations sets on you, like the job roles that were discussed in the first day of interview, and the things that you have accepted. Work for that. Do not overcompensate of the things that of someone else, of your colleague, of or your this thing of your other uh work place friends and stuff like that. So these are a few things, and having a supportive system. I believe that every workplace should have a very supportive environment, because let's just say if today I have to take a break for my own mental health, we need to have people who can take care of our part of or we need to have people that we can fall back to, that we know that he or she will take care for a limited period of time the work that we are not being able to take care. So having a positive, supportive work environment, work culture is very, very important. And yeah, I think that's all I have from my end. And yeah, thank you.
Thank you, Yeja ma'am. Would the other speakers like to add something to the question?
Yes, as HMM has already mentioned about everything very nicely, but I would just like to focus again on that point that compassion and like this sort of unconditional support is expected from us, not just by our clients, but by our family members, partners, and our friends also. So, like, it becomes exhausting, and it also becomes like, when do we take off or turn off our role as a therapist or a mental health worker? So it becomes quite difficult to find that space for us to take care of our own self. So I would just like to stress on that point and say that as we've been discussing throughout this webinar about all the self-care practices and all, it is also important for us to draw that line where we sometimes turn off our role as a mental health worker and just simply be us or be in our own self and give us that space to take care of our own self. So that's all I had to add.
Thank you, Dipshika ma'am. Coming to our last question of the session, even though Yeja ma'am had given a tiny intro about it or a tiny summary about it, what are the different strategies or techniques through which we can prevent burnout and compassion fatigue?
Okay, Alankrita, I'll take that question. Uh, yes, we had a discussion about the strategies Yeja, Dipshika has discussed about it. So all of the strategies definitely it can apply, but when we say preventing, it's something that it's doing way before when the so when a certain result or a product come out. So when we say a job, when we say entering into or uh, committing to an organization, it's a very big thing. It's a very big thing where an organization also welcomes us, as well as they also polishes us with various experiences. They also help us to learn many new things, right? So they even orient us with so many new things so that we can get acquainted with the working area or the field. So they actually provide so many resources that we sometimes feel that, if I tend to leave this job, what will happen? Because the organization has done so much to me. So those kind of thinking definitely stays when one actually kind of things that, if I want to leave a job or if I want to leave any kind of organization. But when we say a job, before than that, one needs to be educated, or one needs to be aware about burnout. And if someone is from this field, then definitely compassion fatigue, because one or the other, definitely one will go through burnout. So rather than going through burnout, one can take certain steps or strategies so that one person can prevent it, right? So with that, I want to start discussing, like, as I have already pinpointed one important strategy, that is mindful breaks. Very, very important. Taking mindful breaks is one of the most important thing, because mindfulness is something when we are at the present. Sometimes when we are working, our mind definitely dozes off with several new other thoughts. We may be, like going through our phone, excessive screening time. So in that kind of area, one needs to go for certain breaks. But one needs to be prepared that if I follow certain strategies, it will be helpful for me. Because one might think that if I go for these breaks, if I go out of the office, or might be if I go out to nature, for some people, nature might be a good therapy. So one need not have to be feel guilty about it, like what will happen regarding my work. So one needs to be very guilt free when someone is taking up the strategies to prevent burnout or fatigue compassion. So as we have already discussed about setting boundaries, very, very important. Whatever your role is, you have to stick on that. And with that, I want to say that you have to be vocal regarding your statements. Very, very important. If you go inside an organization, definitely you will be showered with so many welcoming messages. Definitely it happens. But one needs to be very uh, good with their statements regarding what I need to do and what I should do, what are my duties. Anything, something happening in your office time, anything, you can definitely go to the authorities and speak to them. Because if they are running any company, or might be a small organization, big organization, it's not it's not feasible for the person or the authority person to go through one by one to the person and know what someone is doing or what are the workload. So the person needs to be vocal enough so that, like, for example, if I have got a like too many of workload, so definitely I have to tell the authority that uh, I have been given too much of workload, so definitely it's going on since many days. So this is very, very important. And social interaction, building a good community in your office is very, very important. So that there will be someone so that you could talk. We are social animals. We need to share. We need to talk. Even share a laugh with our colleagues. That is very, very important. So social interactions is one of the thing. And I would suggest exercise. Yeah, exercise, any sorts of exercise. It doesn't need to be an intense exercise. One needs to take care of their physical activity skills, because that will also help us to take or to be, to be focusing more on our strength, and we will be more focused first thing when we uh, might be, if we are doing any yoga, meditation, or might be going to gym, however, how sorts of way it's possible. And if I would say how to prevent compassion fatigue, then I think we have discussed about work life balance. It's very, very important, as Yeja has talked about, not to take, it's not like you have to take work, like office work, to your home, right? So you have to make, not like a, many people are really ashamed about making a routine, like a timetable, what's, when to wake up. Definitely. They think that it's a kind of a childish work. But I think it's very high time that we should, there are too many activities in our life. People are engaging into physical activities. People are engaging into, they are, their offices are located at a very distanceable way, like it's very far away, so it takes a lot of time, might be. So in that kind of scenario, one needs to plan their day to day activity at a good amount of time. They need to know. So when a person joins somewhere in an organization, first few days the person is very relaxed. So that is also something that it could lead to kind of burnout. Then here also I would stress on setting boundaries, very, very important if we talk about compassion fatigue. Then I would say one of the most important thing is boosting resiliency, because it's very, very important. The ability to bounce back from a challenging situation is very, very important, because we chose this area of expertise, and definitely we are we are eager to help or support people, or facilitate guidance, definitely. So we need to be resilient enough so that we can shower, or we can basically facilitate the clients, right? And I think Yeja and Dipshika and even Alankrita have focused more on uh, us, or might be anyone going or having our own mental health professional, and that's quite normal, because if we are not feeling well, or if we are not mentally active, how can we help uh, how can we help the clients, or might be individual who are reaching to us? So we need to be mentally active, or that mental strength needs to be in an optimum level. And with that, I think if you're going through burnout or compassion fatigue, both are different, but if you're going through, then definitely, if you want to go for professional help, seeking professional help is one of the most biggest strength. Don't take it as a kind of weakness thing, because when one goes for counseling or any kind of psychotherapy, definitely that's your strength. You are the most strong person. That's not your weakness, that's your strength. I want to repeat it, because you have taken that decision. There are many people who just asks, like, ma'am, can I come to the counseling room? That's the thing, but the person never arrives. So it takes months and months for them to come. But when a person arrives, that's the, I definitely am proud of the client individual who does that, because that's a highest thing that a person can do. And definitely, if someone from the viewers, or might be anyone who is watching this webinar, you can definitely contact PsychSpace, because yes, we should take care of our mental health. And I think Yeja, Tipshika, and even Alankrita, they can share the Instagram handle also regarding that. So you can definitely contact PsychSpace, because it's highest time we have to prioritize our mental health. Yes.
Thank you, Lisa ma'am. So with this, we have come to the end of our session. So to summarize, our topic for today is that it is very important for us, even though we come from a helping profession, or even we if we are looking at someone, if we are a caregiver, it is very important for us to recognize burnout and compassion fatigue. How can we recognize that? It's like whenever we feel like we don't want to do this anymore, there is this thing we have in our mind: I don't want to do this anymore. But then there's also a thought that uh, uh, this is my profession or this is my job, so I need to work, which is at times which can lead to a lot of stress, a lot of frustration within us. And also it is very very important for us to create boundaries in workspace, boundaries in our also personal lives, also in professional life, like putting us forward and thinking about us, taking care of us. Also, like specifically having proper sleep. It is very important to take rest, to take a break. And sleep is mostly sleep, and uh, healthy diet can help with that. Also, we have to sometimes learn to be assertive. We have to sometimes learn to say no, because being submissive, or be always saying yes, can sometimes lead to emotional exhaustion. Like if it is difficult for us, as Lisa ma'am mentioned, Yeja ma'am mentioned, and Dipshika ma'am also mentioned, that we need to, if as a coming from a professional background, like helping background, professional helping background, if I am not able to handle the patient, it is okay for me to refer it to someone else. I can refer it either to Yeja ma'am, Lisa ma'am, or Dipshika ma'am, and that is completely okay. And also, like Lisa ma'am mentioned, taking mindful breaks, it's very important. It is very important for us to take breaks. It is also important us to prioritize oneself. Prior, like suppose we are now we are psychologists, and the people or the patient or the clients who come to us, they come with a lot of trauma, or with a lot of troubles in their lives, and they are coming here for help. If we ourselves are not able to handle our personal lives, or our, if we ourselves are feeling burned out, how are we supposed to help the other person? It is very important for us to take care of ourselves and then step forward to help another person. So that's all. Finally, I would like to extend my sincerest gratitude to all the speakers of the evening for enlightening us with your knowledgeable words. And also, last but not the least, I want to thank the viewers for the love and support. And also, Psychspace is available in every social media platform. You can follow us on our Instagram page for latest updates and information. And also remember, for any professional help, we are just a DM away. Thank you all. Good night.
Thank you so much, Alankita, for a wonderful
Yes.
session. It was really
Thank
lovely.
you, Alankita.
Yeah.